Hello, my name is David Trimberger, and I am answering the Module 4 Question 2 questions. So this is the scenario of the patient that is having the closed head injury. The first basis of the question is it is talking about when would you treat for the severe hypertension, and then the second part of the question is what BP would you stop treating everything at. So to start off with this, whenever you notice that someone's going through Cushing's reflex, or you know that they have a possible closed head injury, you would want to try and start treating for this immediately. But one of the main signs of when you would want to treat for the severe hypertension is whenever you start to notice that there's possible herniation occurring. So the way that you can detect that possible herniation is coming about is if you see two black eyes, but one of the main things is if you go and you check their eyes, one of their eyes is going to be fixed and dilated. If both eyes are fixed and dilated, that's an even more severe case that is coming about. So the way that you would treat the severe hypertension due to the closed head injury is you would start off with mannitol or 3% saline, and then after these occur, if your patient is still hypertensive, you could then treat it as a hypertensive emergency, and you could administer nitroprusside or a beta blocker such as labetalol. And then when would you want, or what BP would you stop all treatment? So from looking at our textbook, checking PDF or Davis PDFs over labetalol, nitroprusside, mannitol, 3% saline, over all these different medications, as well as the Mayo Clinic, our textbook, a couple different nursing textbooks, I never found an exact square number of when you would stop. But from compiling what everything was discussing, is it was saying that you would stop treatment whenever eyes begin to stop being fixed and dilated, heart rate begins to increase because that means Cushing's reflex is starting to reverse, and also whenever respiratory rate starts to be able to be maintained on their own, or whenever blood pressure begins to start falling back within a normal adult range. Thank you for listening. That is my response.